So the GM Care Record has made a significant positive impact on the ability to deliver safe, efficient care for frontline staff. And that means that patients receive better care and treatment. So for some patients, that could even mean that their hospital stay is shorter.
So at times patients come into hospital and they don't bring their medications, or they forget to mention a health condition, or sometimes they can't remember some of the diagnoses, which are complicated medical words. So it's really helpful that the doctor is able to access this information on the care record and be able to understand what's wrong with the patient.
The benefits of the GM Care Record currently to a patient are pretty much invisible to the vast majority of people across the whole of GM, because they're not using the hospital on a day-to-day basis. It's at the point where they need to go into the hospital that the GM Care Record comes into play, and particularly if it's an emergency admittance.
In an emergency setting, the Greater Manchester Care Record can provide information to clinicians at the hospital which may make a big difference in improving patient care and outcomes, especially in those time-critical situations.
The Oximetry at Home programme is an enhanced programme that we developed in Greater Manchester. What we found is that patients within the first 14 days of their illness could deteriorate and their oxygen levels could drop. And sometimes this could happen without the patient knowing. And if the patients deteriorated, then we were able to pick that up, that deterioration early, and escalate their care so that they managed to get the treatment in a timely manner, which is so important.
A lot of the patients come in unconscious. They're unable to tell us their drug histories, their allergies, their previous medical problems. So having an eye on what's happened to them before makes our decisions safer and quicker, and allows us to reach conclusions much more quickly.
It just improves my husband's access to quality healthcare when he needs it. He's had 2 episodes now of a condition called delirium, which is really a medical emergency. More recently, we've had another near miss with delirium, but it was already there on his record, so when I rang the GPs, they were quick on it, and we got a face-to-face consultation within 2 hours, and were able to avert hospital admission. So it's that important, and it makes that much difference to somebody's care.
So ultimately, the GM Care Record means that patients get safer, quicker treatment, and that improves their health outcomes.
The Greater Manchester Care Record really provides us with a unique opportunity to identify those patients with long-term conditions who might have been adversely affected by the changes to healthcare that we've seen as a result of the pandemic.
As I get a little bit older, I'm aware that at some point I'm likely to be a patient, and I suppose I wish the doctors who are looking after me in the future to be able to have the same access to my records that I benefit from when I'm treating a patient.